Welcome to episode 1 of AlignerCo's podcast, where we talk about all things dental and clear aligners. Today we're joined by AlignerCo's orthodontist, Dr. Athar. Welcome.
Thank you so much. Thank you, Annie.
So we're going to discuss clear aligners, how they work, and we're going to compare them with braces. So first of all, what are clear aligners and how do they work?
Well, clear aligners are basically, it's a discrete way of straightening your teeth. Traditionally, we know that we all know about braces. Clear aligners have been there for a long period, but the first reported case was back in 1940s, actually. So it's been there for a long time. But recently, in last 10, 15 years, they have gained more popularity because advances in technology and everything. So that has gained technology. The way they work is uh, your treatment plan is designed, and then you sequentially change your trays or the aligners, and that exert the force on the teeth that makes your teeth move into a desirable position. So under the supervision of your doctor or orthodontist, they design a treatment plan, and knowing the biology of your bone and the movement of teeth, the velocity of movement of teeth, we are able to achieve healthy smiles.
Excellent, that's great. So what are the differences between the traditional metal braces and clear aligners?
Wow, that's a number one difference is definitely the appearance. That's what everyone notices it. But the way they allow, the main difference between is how they apply force. Okay, so aligners tends to push the teeth into the right position, whereas braces they tend to pull the teeth into the right position. Okay, so they do both work very efficiently and effectively, provided the case is suitable for that, and then types of movement that we are trying to achieve. Both of them have their pros and cons. My favorite about aligners is the hygiene. Aligners are way more hygienic as compared to braces. So whenever I have a patient who is a candidate where I can do either way, I prefer to go aligners because to me, they are more comfortable and more hygienic.
Absolutely, and you don't get food stuck in them.
Oh yes, and then with braces you always have emergency appointments. You have broken brackets, you have poking wires. You're looking for wax to put them. With aligners, that's not an issue, and usually they don't break. So and because you're changing them every week or 2 weeks depending on the frequency of your aligner schedule, how frequently you want to change them. So it's definitely way more comfortable, and especially for adult patients it kind of matches their lifestyle because for them, when you're visiting an orthodontist or your dentist for orthodontic treatment, you have to think it this way that you have to leave work, go to your dentist, wait there for a few minutes, then be seen by the dentist takes about 30, 40 minutes, and then you have to go back to the work. The whole thing is about 3 hours. Uh, so with aligners, you can be actually changing those aligners at home. And as far as they're fitting good, they are working effectively. So the number of visits to dentist are significantly reduced.
It's a lot quicker.
It's a lot quicker, yes. And more comfortable. I think it matches your lifestyle.
Yeah, absolutely. And like you said, for adults as well. Yes. I think there's a bit of a stigma with getting braces as well when you're younger, and a lot of adults don't really want the appearance of metal braces. So it's a lot more easier to fit in with their lifestyle as well in that regard.
I'll tell you one thing that's a very interesting thing that recently, in last 15 years, the number of adults seeking orthodontic treatment or aligning their teeth has gone up by 56%.
Wow.
Whereas amongst the teenager, it's about 15%.
Right.
So that's amazing. Like more and more adults are seeking. I think that's one thing to do is how conscious they're about their smile now with this selfie culture.
Yes.
Because when taking those pictures. And recently, another thing that we have noticed is in my office, I see a lot of patients coming in, and I ask them, and these are adult patients, and I ask them, why are you seeking orthodontic treatment now? And they say, you know what, after COVID, I've been spending a lot of my time on Zoom, And then I realized my teeth are so crooked. So because I'm seeing my own face now a lot
Oh,
of times. So that basically makes them wonder that, oh wow, really? I can get them straightened. And when there are aligners and it's a discreet way, nobody notices it, it's easier for them to do it.
absolutely. Yeah, I agree. So how long does the aligner treatment last?
Depends on the case. I would say it could be anywhere between 3 months to 30 months. There's no upper limit, but depends on the complication, how complicated the case is. But if you ask me on an average, our aligner case is around 12 to 14 months. Okay. Um, some takes less, some take more, but it all depends on the type of the case.
Yes, I suppose if you only have just a few small issues, then it would just take maybe a few months.
Few months, yes. So like 1 or 2 teeth that needs to be moved, you can be done in 3 to 6 months.
Yeah, excellent.
It could be much quicker. So especially if you're just trying to align your front teeth, you know, mostly the treatment that takes longest is when you're trying to move your back teeth, which
Right.
have bigger roots, more dense bone. But if you're just trying to align your front teeth, usually 6 months, 6 to 8 months, we're done.
And that's quite a short period of time when you compare it to, traditional metal braces that people sometimes
True.
use.
Even with braces, you might be able to achieve it, but the only thing is that uh, it takes a lot of time to get your bite adjusted with braces because, as I said, that they break and all this stuff. So sometimes, like in my office, we usually start with upper braces first, then we go towards lower braces. That itself takes about 3 to 6 months before I can even put braces on the lower teeth. Over here with aligners, we can start upper and lower brace alignment of the teeth can be started together.
Yes, yeah.
So that saves a lot of time right there.
Definitely, absolutely. And how long per day should aligners be worn?
So recommended time is about 20 to 22 hours a day. Okay, that's the time that you should be wearing it. Again, that all depends on the density of the bone and the type of movement you're trying to achieve. Some patients wear 12 hours and I see good results, and some in 20 hours they're still struggling. So so it all depends, but recommended time is between 20 to 22 hours a day.
Okay. And I suppose if people don't stick to the recommended time, then just the treatment will be lengthened, so it might take a little bit longer.
It will, and most likely the teeth will not track the way they are supposed to track these aligners. They would not track well, and you will end up getting additional aligners,
Yes.
or basically your treatment will fail. If you go to a doctor and the doctor gives you a medicine, okay, you have to take that medication according to that prescription.
Yeah.
You know, you cannot just say, okay, I'm in a mood to take 2 pills today. I'll take 2 pills today, and then I'll just not take a pill for next 3 days. It's not going to work. So you cannot blame the doctor or the pills in that case.
Yeah.
That, oh, it's not working. You have to follow the instructions. You have to follow the prescription to achieve good results. And again, I want to add one thing to this. Even if you take this is human body, we all prescribe these treatment based on the science and the information we have. How many times you have seen that you take certain medications according to the prescription and sometimes they don't work? This
Yes.
can happen with aligners too. Okay, that does not mean, oh, aligners don't work. They do work. Okay, but one medication is not for everything. Same
Yeah.
thing, aligners are not for everyone. Sometimes we only learn that thing just after using those aligners. Okay, this kind of tooth movement cannot be achieved in this particular patient um, with aligners. So we have to do something else.
Yes, and that's understandable.
That goes with braces too.
Yes, yeah, there's always another option. So are clear aligners safe to use?
Oh, yes, they are. I mean, there are millions and millions of patients who've got this treatment done. Uh, I don't know. I lost my count now. I mean, I was following at one time when it was a newer thing, but I'm sure more than 10 million people must have got aligners by now, or maybe more. But yes, they are safe. The plastic material that's being used is tested and has been used for a long time. A lot of time patients ask me that is there a chance that they can swallow the aligner? I don't think so. That's a huge thing to swallow.
Yeah.
You know, you will cough before you will swallow that thing.
Yeah.
It's a big. One thing that can happen, that if a piece of plastic breaks, possibly can you swallow it? And that never happened with any of my patients, but that's been discussed. Yeah, but it's not a very common thing. The aligner material that we use is very strong, and they don't break that easy, you know. And breaking and then swallowing it is a very, very rare thing. As I said, that I've never experienced it, but I've heard of it.
Okay, excellent. And then, can you wear aligners when you're eating and drinking?
So the simple answer is no. Okay, you should not. Now, if you're eating, definitely, I don't think so. You will enjoy your food with aligners on. I don't know.
Yeah,
I
might
won't.
struggle.
Yeah, you know. But the other thing is that if you're drinking something, if you're drinking water, I think that's perfectly fine. Okay. Anything hot, definitely no, because it's plastic, you know. Anything acidic like sodas or juices, I would not recommend drinking those with aligners on, because two reasons. Number one, the acidic environment itself can damage or weaken the plastic material. The other thing is there's always a small gap between the tooth and the plastic, and the liquid can creep into that area and will stay against your teeth, which will cause cavities. So now, if you are at a social event and you are embarrassed to take out your aligners and you have to drink something, okay, you are drinking something, then my recommendation is yes, drink with it, but as soon as you get a chance, just go to the restroom, take it off, rinse your mouth, and put it back in again. Okay. Don't let the fluid stay against your teeth for a long period of time.
Especially if you're drinking something like red wine.
Yes. Oh, yeah, that will leave some stains.
Okay, and then final question, do aligners hurt?
Okay, so do aligners hurt? Yes and no. Let me kind of clarify this answer, okay, a little bit. So it's not the aligner, it's the pressure that aligners are putting on your teeth to achieve that specific tooth movement. Whether you do aligners, braces, or anything else, that's the pressure that you feel, and that sometimes hurts. Now, my patients who have got braces and aligners both, they have reported that aligners hurt way less. Okay. I have done almost 2,500 plus aligner cases. Okay. Personally, I've never prescribed a pain medication to any of my patients. Okay. Um, if anything, you can just take over the counter Tylenol, Motrin, whatever you take for your headache. Okay. You can just take that stuff, and that should be good enough. So they don't hurt as much. I would say good 50-60% of my patients might not even take anything, but the remaining would just take some over-the-counter pain medication. So the question is, do the aligners hurt? I think it's not the aligners, it's that your teeth are hurting because they're moving.
Yeah.
So let's not blame aligners for that.
Yes.
And then we know that if there's no pain, no gain, right?
Absolutely. It'll be worth it for the end result.
Yes, definitely.
Thanks for joining us on episode 1 of AlignerCo's podcast with orthodontist Dr. Athar. Make sure you're following us on our social channels, and we'll see you next week for episode 2.